expressed on the preceding sponsored program were strictly those of its hosts, guests, and callers, and not necessarily those of the station, its staff, management, or sponsors.
Talk 1470 is WWNN Pompano Beach and 95.3 FM W237BD Boca Raton. The Health and Wealth Radio Network, 1470 AM and 95.3 FM. The Health and Wealth Radio Network. Tune in for Barry's Supplement Hour with Keith Nevins every weekday morning at 11 a.m. WNN.
If you suffer with diabetes, there's a 25% chance that you'll develop a foot ulcer that can lead to severe health consequences, including amputation. At the Sole Authority, at little or no cost, you can receive your very own therapeutic shoes and custom inserts. Medicare recipients are entitled to 1 pair of quality diabetic shoes and 3 custom inserts. Call the Sole Authority today, 954-597-7060.
Times are tough, and right now those in the commercial world know that being heard via advertisements is the name of the game. AmpSquare.tv understands how important advertisement is and is proud to express that it's truly the only plugged-in internet television production company on the market. Amp2.tv live streams all their shows across all the major selling markets in the U.S. and abroad. Call them at 866-224-5422. The AmpSquare.tv library allows productions to be seen over and over again, making commercial platforms more usable. Call 866-224-5422. Toll free 866-224-5422. Amp2.tv, the first and only internet television network that's truly plugged in. 866-224-5422. That's AMP2.TV.
Talk here. Talk there. Talk 1470 AM and 95.3 FM. The Health and Wealth Radio Network. WNN.
The opinions expressed on the following sponsored program are strictly those of the host, guests, and callers, and not necessarily those of this station, its staff, management, or sponsors. Amp2.tv presents You and Your Doctor, teaching you to live a longer and healthier life. Proudly sponsored by All County Healthcare, where people are the heart of our business. All County Healthcare is a Medicare certified agency where one call will service all your home care health needs. For more information, call 954-717-7027 or visit our website, allcountyhealthcare.com. Now, let's get informed to living a longer and healthier life. Here is your host for today's show.
Hello, South Florida and beyond, and welcome to You and Your Doctor Show. I see the on-the-air light is orange, and so am I today for the listeners driving around. And you'll see me on video as well. I'm actually Mario Batali here, the Italian chef. But we're going to take you on, we're going to chop up, make a course of delight tonight in the world of healthcare. We're going to prep you. Then we're going to get our mise en place ready, and then we're going to actually cook the entree and tell you a ton about what's going on in the world of healthcare tonight. But before we get started, I just want to thank the sponsors of the show, All County Healthcare. They're a Medicare certified agency where patients are the heart of their business. allcountyhealthcare.com or 1-888-717-7170. If you have any questions about healthcare in general, home healthcare, or even Medicare, Maddie can help you out. Again, it's 888-717-7170. We have an action-packed program tonight. Like I said, we're going to be talking a little bit about Medicare and open enrollment that's about to start right around the corner. And then on the second half of the show, we're going to keep the discussion going on COPD and IPV treatments, which you've been hearing us on the radio. If you have any questions, the number is 1-888-565-1470. And if you ever have the inkling to have your doctor on the show interviewed by me, just, reach out, let us know, and we'll have your doctor on the program Always looking to talk to the best cardiologists, orthopedic surgeons in the area, neurologists as well as healthcare professionals and anyone in the health landscape. I'm really glad to welcome back to the program. You remember from last week, Sandy Jacobson. He's a certified insurance agent and specializes in life, health, Medicare, and cancer. Sandy, welcome back to the program. Thanks for coming aboard.
Well, thank you, and happy Halloween to everybody.
Happy Halloween, definitely. We got it in the middle of the week here. It's kind of a quick one.
Yes.
Yeah, great weather on the weekend, and then Halloween's here, and then we got to get back to the rest of the week. And I wanted to have you on again because I realized tomorrow you are going to be busier than an accountant during tax season. And the reason why is of open enrollment, which we talked about in depth last week. But it's right around the corner. I think we said it starts November 6th?
Well, actually, open enrollment begins for Medicare products October 15th and goes through December 7th. Open enrollment begins for health insurance for the under 65 market, begins tomorrow, November 1st, and goes through December 15th this year. It's a shortened year. It used to go through January 15th. So it's only 6 weeks.
Man, that's a lot to be done in 6 weeks. And you help the general public navigate the different parts of Medicare, correct? Is that where you come in and then help them to get the plan that best fits their needs for the, I guess, future of healthcare over the next year, right?
Well, yes. Actually, I've been doing this with my clients for 20 years now. And what I do is meet with each person individually.
Okay.
And find out, a little bit about them, what their needs are, and they can change every year. So it's a good idea to always set up an appointment, discuss it, go over the options, and see what is in their best interest for the following year.
And I will tell you, Sandy Jacobson, certified insurance agent, we were just talking, you have 7 appointments already tomorrow, Wednesday, November 1st. That's correct. So we're going to have to get on your schedule here in the next few weeks if we want to see you. So I want to tell listeners, don't hesitate. I'm going to give his number out a few times during the program and how to get in contact and where to meet and talk a little bit more. But let's start exactly where we did a few days ago. Briefly, if you will, explain Medicare and how does it work?
Okay. Medicare actually it's a federal health plan that started in 1966 and offers health insurance benefits to people age 65 and older and also to people that are on disability. Medicare has several parts to it. There is federal Medicare, which is under what's called Part A and Part B. Then you have what's called Part C, which is Medicare Advantage plans. You have Part D, which is the Medicare prescription drug plan. And then you also have Medicare supplements. Medicare A and B, as I mentioned, is a federal plan. Okay. Part A is covers you if you are admitted into the hospital. It also covers you if you've been in the hospital for at least 3 days, and within 30 days of being released, you need skilled nursing, some sort of therapy. Then Medicare, that falls under Medicare Part A as well as hospice. And then Part B also, which is federal, is pretty much everything outside the hospital, such as doctor visits, outpatient testing, surgeries, durable medical equipment, and so on. Just about everything but prescription drugs, of which we mentioned Part D is the prescription drug plans. And then Part C is Medicare Advantage plans. Medicare Advantage plans are a little different in that you give up your coverage with the federal government to be insured by a private insurance company.
I see. Okay. That's a lot that we've heard of the Advantage plans the last few years as an option in during open enrollment, as an option to the general public. Those are those Advantage plans.
The Advantage plans, yes, during the open enrollment, which we're currently in, is the time of year when you are permitted to change Advantage plans, move from an Advantage plan to original Medicare and a supplement. That's the time of year other than when you first qualify for Medicare, which is usually when you turn 65.
Are you seeing an uptick lately because of the baby boomer population, I guess, growing and becoming, it's really the largest population we have in this country now, right?
Yes, that's correct. There is quite an uptick, frankly. There's approximately 10,000 people per day turning 65 in the United States. So,
unbelievable. Yeah. That is amazing. I mean, that is the largest population. And I'm sure they have a lot of questions for you on what to select. And I have one of the questions just from talking. Can you combine A or B and certain plans, or are you stuck in your Part A, your Part B, your Part C, your Part D? How does that work?
Well,
does it cross over?
You have a choice. You can enroll in original Medicare, which is Part A and B, or you can enroll in an Advantage plan Part C, but you can't enroll in both at the same time.
Oh.
Yeah, and if you choose original Medicare, which is Part A and B, then you're permitted to purchase a Medicare supplement and a Part D drug plan as well. With an Advantage plan, it's Advantage plans. Some of them have drug plans included, some of them don't. But you cannot purchase a standalone Part D drug plan with an Advantage plan.
I see. It sounds, I know you get into it with the customers and explain everything to them, but it sounds like A and B would be probably the way to go with that, help with the prescriptions with D instead of an exchange.
Well, I recommend original Medicare and a supplement, and I do that for reasons because original Medicare, I think there's quite a few benefits that far surpass what the Advantage plans offer, and that is such as, first of all, you're being insured by the federal government. You have no network of providers. That means that, and to me, that is really big, okay, because you can choose the doctor you want to see, and that means anywhere in the country, if a provider accepts Medicare, you can see that provider. So if you need to see some sort of specialist or go to a special hospital for a need, then you can do that. As long as they accept Medicare, you can go to that facility or that provider, and by having original Medicare and choosing a supplement, you possibly could have all of that with no out-of-pocket costs to you.
I see. So let me get this right. If you're over, okay, so you took a trip over to Biloxi, Mississippi, over to the casino, and you had a little pumpkin spiced rum, a little too much pumpkin spiced rum, and you broke a bone, you could see any doctor over there in Biloxi, correct?
Any doctor that's right. Any doctor that accepts Medicare, you can see them. Yeah.
Oh wow, that sounds like that's so much more important nowadays. I know everyone's different, but I had that happen to me. My wife and I were in Hawaii, and we were at a network, and the VOG was coming in, the volcanic ash, and it got in her chest, and she got really sick and had to go out a network and get a steroid shot, and it cost us $600, and it wasn't covered. So that's tough to have that choice, to be able to, make your own decisions when you're on vacation or away from home. If you have to see a super specialist or something, am I right about that?
Well, absolutely. I believe that. Yeah. As I mentioned, original Medicare. There's no networks. You can go.
Yeah.
Pretty much choose anywhere you want to go in the country.
Awesome.
With Advantage plans, there is always a network. You most often have to stay in that network. There are some plans where you can go out of network. However, your out-of-pocket expenses are increased by quite a bit. So you are pretty much stuck being in your network. And oftentimes those networks are called narrow networks. And physicians, hospitals, they can go in and out of networks anytime they choose, and they often do, which is quite a problem with the Advantage plan. It's another reason why I favor original Medicare, because providers prefer the original Medicare and a supplement.
Fantastic. Sandy, hold that thought. We're going to take a quick break. On the other side, talk a little bit about open enrollment for Medicare with Sandy Jacobson, certified insurance agent, 5614-506557 on the You and Your Doctor show.
If you believe you can or you believe you can't, you're right. What do you believe? Who is the only person who can stop you? Only you. When was the last time you have someone holding your vision, your dreams for you? When was the last time someone held you accountable for achieving them? That's when Lorena Anderson steps in and becomes your coach, your personal energy coach. With her powerful and proven techniques, she will assist you in assessing and accelerating your maximum potential. One of the most powerful tools is quieting your mind and relaxing your body. It allows you to de-stress and calm, and eventually brings your happy back. If finding your happy is important to you, please call the Energy Shifter, Lorena Anderson, at 954-647-5525 to schedule a free half-hour phone session, or email her at lorenaanderson@gmail.com. She's looking forward to connecting with you. Call her. All County Healthcare, Inc. is locally owned and operated, serving the Tri-County area, Palm Beach, Dade, and Broward counties for the last 25 years. The practice of medicine is changing dramatically. All County Healthcare, Inc. still does it the old-fashioned way, where our nurses and healthcare professionals come into your home to service your medical needs, providing you the fastest and best care possible. For more information, call 954-717-7027. And remember, Medicare Home Care is covered by Part A of Medicare with no out-of-pocket cost to you. It's your decision, and only your decision, on what healthcare agency you use. Call today. All County Home Health Care, Inc. at 954-717-7027. License 200999096. You are listening to You and Your Doctor, Living Longer and Healthier, an informative show that helps you find answers to questions you always wanted to ask, but did not have that somebody that could make a difference in your life. Call into the show if you have a question at 888-565-1470, and we will put you on the air to inform all our listeners. Now, back to our show.
Thank you for coming back. Again, All County Healthcare is the sponsor. They're a Medicare certified agency. If you have any questions, you can call Maddie at 888-717-7170, allcountyhealthcare.com. Sandy Jacobson on the set tonight, certified insurance agent. We're talking Medicare because open enrollment is going on, and another portion of it is starting right around the corner, all the way up until mid-December. And you're going to correct me if I'm wrong. But before we broke, we were talking a little bit about Medicare original plan versus the Advantage plan. And one of the questions I wanted to ask you is the cost different between the two?
Yes, it is. Original Medicare, Part A, usually there's no charge because you've paid for it your whole life when you were working. Part B is optional, but you really need it, and there is a charge for that. It is based on your income, but typically most people pay about $134 a month for that, and it is needed. And then if you choose to have a Medicare supplement, prices range, depends on the plan you choose. But there's quite a few plans to choose from, and it can be very affordable. And you can also have plans that will pay for everything that you would experience, no out-of-pocket, very comprehensive. Then along with that, you would need what is a Part D drug plan, which is usually very inexpensive and gives you very nice coverage for your medications that are needed outside of the hospital. With an Advantage plan, costs that the benefit of an Advantage plan is they typically have a low or no premium. However, there's a trade-off for that too.
There always is.
Yeah. I guess they say you don't get anything for nothing. But anyway, the way it works is if you use your plan, okay, you will have let's say you go to the doctor, you have a copay. Let's say you need something as an outpatient, maybe a surgery or a test or whatever, you have a larger copay. If you need to be admitted into the hospital, then you have a much larger copay. It's usually you pay a copay daily up to a certain amount, which can usually run anywhere from $1,500 up to $3,400 based on the plan that you have. So you can actually have a lot more out of pocket than you would with original Medicare if you actually use your Advantage plan. Advantage plans, as I mentioned, some of the plans do include prescription drugs. Some of them do not, so you have to be careful about that. Also, the Advantage plans try to entice people to sign on by offering things like added dental, added vision, things like that, which are just actually discount plans that are very inexpensive in the open market. They also offer sometimes something called silver slippers, which is gym benefits. But in my opinion, you don't base the health insurance plan that you want on those added benefits. You want a plan that's going to protect you in case something serious should happen to you, and that's why I recommend original Medicare supplement and a Part D plan, because if you ever have a serious event happen, you're going to be able to pick the doctor, as I mentioned, that you want, and you can pick the finest doctors. With an Advantage plan, you're going to have to usually stay in the network, and typically the more the specialist, the doctor specializes, the less amount of doctors are in the network. So you may end up needing something like maybe open heart surgery, and you prepare for it and you find out that maybe there's only a couple of doctors in the network that do that, and your primary doctor may not know who they are. But that's who you're going to have to go see. Whereas with original Medicare, you can go to the finest. And
wow.
And to me, that is what it's all about, because as you get older, that's the time when you're probably going to have some issues if you ever do in your life, and that's when you need the best protection.
We've all had relatives, friends, direct family impacted by diseases. So, I mean, chances are eventually it's going to happen to all of us. But I did want to kind of bullet a few points that you said, Sandy. One was, so Medicare started in 1966. That was Lyndon B. Johnson was president?
His administration,
That's
correct.
Right. We talked about that last week.
Yeah.
There's a new movie coming about him, so that's very timely. Forget the actor that's playing it. It's a really big actor.
Woody Harrelson, I think it is.
Woody Harrelson
yes.
is Lyndon B. Johnson.
Yeah.
Wow, that is, anything Woody touches is really fun. So that's going to be really neat to see and get the historical perspective. That's very timely. Another thing that you mentioned, so when we're working men and women, that Medicare that we're paying in our paycheck, that's the Medicare that tax is going to that Medicare A.
That's correct.
For our peers, our older friends and family down the road.
Yes, you're paying into it while you're working so that when you achieve the age and go on to Medicare, you don't have to pay for Part A.
I see.
You've already paid for it, yeah.
Wow. Will that model keep going? Because, there's a lot of talk about, is Social Security going to make it? Or eventually it's going to run out. Will Medicare, will that model ever be something that we'll be without, say, like my generation or even younger?
Well, you never know, but I'd have to say no, because it's become such a benefit to so many people that I don't think that they would ever let that go away.
Oh, that's one
There's
good
been
thing
talk,
that we can.
Yeah, but I just can't imagine it could ever happen.
Okay. It's always good to stay in tune to, your local congressmen or women and see what they're up to, because if you do, I mean, you're on top of it.
Doesn't
if
hurt
you
to
don't,
remind them.
yeah, we all have the right to vote, so that's the one right that we can really use. Another question I wanted to ask you, I know we're going kind of like compare and contrast original versus advantage, but I wanted to ask you also about how does home health care differ with original versus advantage? Is there a big difference there?
Well, there is. Typically, with original Medicare and a supplement, you're going to have a much larger choice of Medicare certified home health agencies to choose from. Usually the top tier accepts only original Medicare. With the Advantage plan, typically the network is much smaller, and the Advantage plan has some power to award or not award the benefit to you when you need it. With original Medicare, it's your doctor that makes the call.
Wow. I definitely want my doctor making the call, I tell you that. And the out-of-pocket, too. That can be tough from time to time. As Americans, I mean, the economy's good right now, but it's still, like, with inflation and everything else, it's still tough to, even if, to make a living or to keep the standard of living. So any more money out of pocket, I think it would be a no-brainer to stick with the original. But if you have questions, you can call Sandy Jacobson, certified insurance agent, 561-450-6557. Now, you were telling me this doesn't always have to be a meeting at your office. I mean, you'll meet at everyone's at Starbucks nowadays. You meet at Starbucks or something like. How does it work? Take us through a meeting. Where can people meet you if they set up a meeting, and what's a meeting like from front to back?
Well, my office is in Delray Beach, and anybody's welcome to come there. However, I offer a lot of service. I come to my clients if they choose that. I can meet them at a neutral spot like a Starbucks, or we can just do it over the phone. With technology today, a computer and a phone, we can pretty much do everything. Some people prefer to, for it to be more personal and to meet and talk, and that's fine with me. Yeah, they're always welcome to come. I am in Delray Beach, however, I can cover the whole state of Florida.
Oh, yeah, that's right. The whole state. Wow. Unbelievable. And this isn't something that you've just started doing. This is something every year you have to be certified for. I know you have to do a lot of studying. You have to pass an equivalency of over 90 or above, you were telling me, which seems like a pretty tough thing to keep up with every single year. You have to be certified to sell all these parts and plans. The whole state of Florida going along with that. I'm sure that's a lot on your plate too. So just to be able to do this, I mean, we're really lucky to have you. Take us through a little of that, for the listeners.
Well, there's a lot of certifications that we agents have to go through. First of all, we have continuing education courses we have to take every 2 years. Every year to be able to market products for the under 65 market through the federal exchanges, you have to be certified through that. So you have to take a course and exams every year prior to open enrollment. And the same with Medicare Advantage plans as well, is that you have to be certified by taking courses and passing exams to be able to offer those products. And that you have to do annually and prior to the open enrollments.
Wow, that is a lot to keep up with. You're a busy man all year long.
Well, yeah. I just wanted to say, too, a couple things about therapy and home health care while I have a chance. Again, I always favor the original Medicare and a supplement because of the coverage it offers and the quality of care that you're going to get. And that I mentioned that with original Medicare for home health care agencies, you get the top tier agencies. And I just wanted to say that All County Healthcare, who happens to be the sponsor of this show, I know very well. And I highly recommend this company because I know how they operate, how their training goes for their employees, and how much they care about making sure that their clients are taken care of well. So always All County Healthcare is the company that I would recommend for anybody that needs home health care.
That's great to hear, with all that's been in the news lately, with the way our elders have been taken care of. That's really good to hear, and really we're lucky to have a great home health care agency like that right here in the Tri-County area, and to have you as well, and for you to take the time, because I know you're like like I said before, you're like a accountant during tax season starting tomorrow, but there is room to talk with you on the phone or meet you in person if you like that. You're like a reporter like me. Like I used to use the phone all the time to do my reporting, so that's kind of very convenient for people. So that's good to hear, where you don't even have to meet. But if you'd like to meet with Sandy, he can do it. Again, 561-450-6557 or sj1266@att.net is the email. Well, thanks again. I mean, it's hard to believe we ripped through 30 minutes again on this, but you've been great, kind of painting the landscape of Medicare for us and teaching us a little about it.
Well, thanks for having me.
Definitely, and come aboard again when you're not so busy. But open enrollment again goes till December 15-ish.
Well, for Medicare, it's through December 7th. For the under 65 market, it's through December 15th.
Okay. So there is a little difference there. Okay, so take that down and remember to call Sandy. We're going to take a quick break and on the other side talk about COPD and IPV treatments on the You and Your Doctor show.
If you believe you can or you believe you can't, you're right. What do you believe? Who is the only person who can stop you? Only you. When was the last time you have someone holding your vision, your dreams for you? When was the last time someone held you accountable for achieving them? That's when Lorena Anderson steps in and becomes your coach, your personal energy coach. With her powerful and proven techniques, she will assist you in assessing and accelerating your maximum potential. One of the most powerful tools is quieting your mind and relaxing your body. It allows you to de-stress and calm and eventually brings your happy back. If finding your happy is important to you, please call the Energy Shifter Lorena Anderson at 954-647-5525 to schedule a free half-hour phone session or email her at lorenaanderson@gmail.com. She's looking forward to connecting with you. Call her. All County Healthcare, Inc. is locally owned and operated, serving the Tri-County area, Palm Beach, Dade, and Broward counties for the last 25 years. The practice of medicine is changing dramatically. All County Healthcare, Inc. still does it the old-fashioned way, where our nurses and healthcare professionals come into your home to service your medical needs, providing you the fastest and best care possible. For more information, call 954-717-7027. And remember, Medicare home care is covered by Part A of Medicare with no out-of-pocket cost to you. It's your decision and only your decision on what healthcare agency you use. Call today. All County Home Health Care, Inc. at 954-717-7027. License 200999096. You are listening to You and Your Doctor, Living Longer and Healthier, an informative show that helps you find answers to questions you always wanted to ask but did not have that somebody that could make a difference in your life. Call into the show if you have a question at 888-565-1470, and we will put you on the air to inform all our listeners. Now, back to our show.
Thank you for joining us, South Florida and beyond, and we're back on the You and Your Doctor show. I'm actually David DePino, but I'm dressed like Mario Batali because it's Halloween. Did you get it, Ed?
Good job, too.
Okay,
yeah.
You got it then. Definitely. So Halloween's midweek this year, so we're having a little fun. But I just want to tell you again, All County Health Care. I'm showing the viewers, but for the listeners, this is a Medicare certified agency that sponsors this show. Patients are the heart of their business. If you have any questions about home health care, Medicare, navigating, they have the sources, the experts to actually do the best in taking care of you or your family. 888-717-7170, allcountyhealthcare.com. And we stream live on their Facebook live page, so you can find us there. I wanted to have back on the program again because this is such a timely topic and a very, busy time with open enrollment and all that's going on. But we hear COPD always in the news, that acronym. Lately, it's just kind of grown because I know we're going to find out a little bit more. Unfortunately, those numbers are growing with the pulmonary disease. But I wanted to welcome back on the program Ed Salazar. Ed, how are you doing tonight?
Doing real well. Thank you very much, Dave.
And thank you for coming back on the program again and taking the time. So give us a little update on what you're working with for All County Healthcare in the terms of, I guess we're going to talk a little COPD and then IPV treatments down the road here.
Well, the COPD program at All County Healthcare continues to have tremendous outcomes. Every patient that has gone through the protocol that we've established has had a relief of their symptoms, and we've had a significant reduction in exacerbations or a decompensation of the patient that requires them to be hospitalized. As I said last time I was here, nationally, COPD, and this, by the way, this is COPD month.
Oh, wow.
COPD month.
For October or November?
October.
Oh, October. Okay. So we're in it.
And Respiratory Therapy Week. I remember you said you had a sister who's a respiratory therapist?
Yeah, so we're very timely on the show. Yeah, my sister, Lisa DePino, is a respiratory therapist in the NICU unit at Jupiter Medical Center, and she's also a registered nurse.
Mm-hmm. Well, this was Respiratory Therapy Week last week, I think. Yeah.
Wow. We are timely tonight. That's awesome, though. I mean, we're bringing the expert health to the listeners and viewers.
Mm-hmm. Well, I thought it might be interesting to provide a few statistics for your listeners. Respiratory diseases, are the fourth leading cause of death in the United States right now. And last year, there were approximately a little under 150,000 deaths in the United States attributed to COPD. Now, that's deaths. That doesn't include, the suffering of people who are having these exacerbations I mentioned, people that, have severely compromised quality of life. And we're just talking about deaths. In Florida specifically, there are about just under 70,000 admissions per year in all the hospitals in Florida. Total number of admissions for exacerbation of COPD is just under 70,000 a year. And the thing that, again, that is causing so much concern with Medicare and other healthcare payers is that a significant number of these patients in Florida, a little more than 9%, are readmitted back into the hospital within 15 days of being discharged. The gold standard for what they're trying to achieve is a reduced 30-day readmission rate. So you can imagine if the 15-day readmission rate is 9%, what is the 30-day readmission rate? And again, the experience that All County Healthcare has with this COPD program that they've set up using the IPV technology, their actual experience is a little less than 5% readmission rates for 12 months.
Wow.
And that's, that's huge,
So let's let's turn it back a second. So we had Dr. Dale Azabal from Palm Beach Gardens Medical Center on the show last week. He's a pulmonologist.
Right.
He's actually doing a lecture Thursday, November 2nd, 6 to 7 p.m., Palm Beach Gardens Medical Center on COPD. But from a respiratory therapist standpoint, I mean, you've studied this your career. What actually is COPD, the acronym, and how does it affect people?
Okay, chronic obstructive pulmonary disease. And chronic obstructive refers to the airway obstruction that people have. And it's primarily due to airway inflammation, increased mucus production, very thick secretions, in effect cough, right, in their lungs. Most of the time, COPD is a combination of two conditions. Emphysema. And emphysema is just a condition where you have a hyperinflation of the lungs and you have a destruction of the individual little air sacs, the alveoli.
Mm-hmm.
Now the human lung has an incredible amount of reserve. What we were always taught in school was that if you took every single alveoli in the lung and you laid it out, that you'd be able to cover a tennis court. That's how much surface area there is in a normal, healthy lung.
Wow.
So people can do a lot of damage to their lungs before they really become aware of it because you have so much reserve.
Mm-hmm.
I'll give you an example. A normal male that has a cardiac output, your heart normally pumps about 5 liters a minute of blood, okay? If you start exercising to your maximum, you might be able to increase that to 25 liters. So that would be your cardiac reserve, right? With your ventilation, again, it's usually right around 5 liters a minute, for an average male adult. But if you exercise to your maximum capacity, you can increase that to about 140 liters a minute.
Wow.
So the pulmonary reserve is much, much higher than the cardiac reserve. But again, that's why people will say, well, I've been smoking forever. I feel fine.
Mm-hmm.
Well, put them on a treadmill.
Yeah.
And
they're not exercising all the time.
Right, because again, they got so much reserve that can be destroyed before they really, become compromised.
Yeah, and then we talked a lot about IPVs as well, the treatment. Now, that mucus is getting stuck during COPD and it's not getting broken up, or the person has a hard time breaking it up, and that's when it becomes obstructive. But something like an IPV treatment, correct me if I'm wrong, but it's a percussive treatment that helps to open that airway and break up, that help the person kind of clear that mucus buildup.
If your lungs are congested to the point where to cough effectively, you got to get air in your lungs first, right?
Yeah, you suck in. Yeah.
Well, if your airways are already severely obstructive, that's kind of hard to do. Plus, you'll see a lot of people with COPD. They have like a barrel chest, hyperinflated. Well, many times they're air trapping.
I have seen that.
The air gets in there, but now because the obstruction of the airways, they can't get it out. So that they look barrel chested, hyperextended. This is more commonly attributed to the emphysema portion of COPD than the bronchitic form.
So this readmission into hospitals that's going on in hospitals, and as we talked a little bit about, hospitals can be is not the word, I don't know if the word fined is correct, but they can be kind of reprimanded in a way by the government for too many readmissions. So this is kind of a no-brainer in keeping people out of the hospitals for something like COPD, if something can be done at home or elsewhere.
Well, CMS, the Centers for Medicare and Medicaid Services, they have stated that they will scale up a return of payment to hospitals, physicians, when they experience these readmissions. So, and I don't know exactly what the numbers are, but say for instance, if Medicare now in the state of Florida, the range for admission for exacerbation of COPD is about $30,000 to $50,000 for a 4 to 5 day admission. Now, if Medicare, if this patient gets readmitted, and the Medicare starts saying, okay, well, we're going to penalize you for not taking care of this patient properly the first time, we are going to reduce your reimbursement by 5%. And my understanding, and again, I'm just pulling that 5% number out. I know it's something like that, but they have an intention of scaling that amount up over time if their outcomes do not improve. Okay, so that's what All County is all about. What we try to convince the hospitals of is to partner with us for a transitional care program where the hospitals, do a good job of resolving the condition, making the patients more comfortable, stabilizing them, and then discharging them.
Okay.
But once they get discharged, that's where we would like them to partner with All County Healthcare, because they have the technology that will keep these patients from re-exacerbating. Now, if a patient with COPD is doing just fine with their conventional therapy, they're doing fine with their nebulizers, they're doing fine with their medications, great. But for those higher acuity patients that are experiencing a frequent decline in their condition and exacerbation, obviously what they're doing isn't working. So all we're suggesting is that they take a look at an alternative therapy
to keep them out of the hospital.
Right. And IPV, it not only does it give them their medicated aerosol, but it simultaneously delivers that percussive action, which helps not only break up the mucus but mobilize it. So even if a patient has a very ineffective cough or no cough, we will still mobilize those secretions.
Wow, just sometimes just need to take a look, at the way of doing things differently. I think we need to do a lot of that in this country. Everyone knows my feelings on that. We talked a few times. But Ed, hold that thought. We're going to take a quick break. On the other side, you're going to give us some statistics on COPD and respiratory diseases being the 4th leading cause of death in the U.S. Amazing on the You and Your Doctor show.
If you believe you can or you believe you can't, you're right. What do you believe? Who is the only person who can stop you? Only you. When was the last time you have someone holding your vision, your dreams for you? When was the last time someone held you accountable for achieving them? That's when Lorena Anderson steps in and becomes your coach, your personal energy coach. With her powerful and proven techniques, she will assist you in assessing and accelerating your maximum potential. One of the most powerful tools is quieting your mind and relaxing your body. It allows you to de-stress and calm and eventually brings your happy back. If finding your happy is important to you, please call the Energy Shifter Lorena Anderson at 954-647-5525 to schedule a free half-hour phone session, or email her at lorenaanderson@gmail.com. She's looking forward to connecting with you. Call her. All County Healthcare, Inc. is locally owned and operated, serving the Tri-County area, Palm Beach, Dade, and Broward counties for the last 25 years. The practice of medicine is changing dramatically. All County Healthcare, Inc. still does it the old-fashioned way, where our nurses and healthcare professionals come into your home to service your medical needs, providing you the fastest and best care possible. For more information, call 954-717-7027. And remember, Medicare Home Care is covered by Part A of Medicare with no out-of-pocket cost to you. It's your decision, and only your decision, on what healthcare agency you use. Call today. All County Home Health Care, Inc. at 954-717-7027. License 200999096. You are listening to You and Your Doctor, Living Longer and Healthier, an informative show that helps you find answers to questions you always wanted to ask, but did not have that somebody that could make a difference in your life. Call into the show if you have a question at 888-565-1470, and we will put you on the air to inform all our listeners. Now, back to our show.
Medical research.
Hello, South Florida and beyond, and welcome back to the You and Your Doctor show. Again, we're talking COPD, very timely, as it is COPD Awareness Month in October. And with all that's going on with chronic obstructive pulmonary disease, thank you, Ed, for the acronym there. But we are sponsored by All County Healthcare Incorporated. The viewers can see that right there. Listeners, if you have any questions about home health care and Medicare certified agencies like All County Healthcare, you can call Maddie at 1-888-717-7170, or you can go online, allcountyhealthcare.com, or even more, we're Facebook Live on All County Healthcare's Facebook page, which is really neat with all the people sharing those social media nowadays. Ed, we were talking before the break, and you had mentioned it one other time, that respiratory diseases are the 4th leading cause of death in the U.S. So I'm thinking, probably heart disease, cancers.
People would be floored if they knew what number 3 was.
Is it auto accidents?
Medical errors.
Oh, no.
More
I don't
people
want to
die.
hear that.
Well, if we have time, we'll talk about that a little
No,
bit.
I know, and that you hold that dear to your heart. We learned that last time. But before we go into that, let's talk a little bit more about is there enough research going on for COPD and these respiratory diseases? I mean, I'm looking at some information you shared with me from the National Institute of Health, which is one of the sources I use. I'm very familiar with them as a reporter, and I have a friend who actually works there from high school, Jackie Dozier Franco. She may be listening online. She's there, I believe, in Washington, D.C. area. Now I follow her, and she works for National Institutes of Health, so we'll have to get her on the program if that allows. But what kind of research is going on for the 4th leading cause of death in the U.S.?
Well, again, I took some information from the NIH's website, and heart disease remains the number 1 cause of death in the United States, with over 614,000 deaths last year, and $1.2 billion invested in research for heart disease. Cancer, number 2, just over half a million people, and $6 billion.
Wow.
Don't get me started on cancer research. I believe that there is a cure for cancer. I believe that immune therapy is the answer. But for reasons we can only speculate on.
And I saw that recently, the woman in California, was that on 60 Minutes? Did you catch that? Okay, yeah, we can do another show on that, but that is amazing.
I would love to.
Yeah, that is really how she's kind of being held back.
But now here's the thing that is concerning, and this one another reason why I am so dedicated to All County Healthcare and what they're doing. I'll get back to why I believe more home health agencies aren't doing this. But even though almost 150,000 people died of COPD in the nation last year, only $97 million was spent on research for COPD. And most of that research was in developing new drugs, because they're the people that have the money to invest in the research, right?
Wow.
Well, over the last 20 years, dozens and dozens of new medications have come out, but there has been no change in outcome. What I found as a respiratory therapist so attractive and intriguing about IPV is this is physical medicine. It's not pharmacologic. It's used in conjunction with the aerosolized medications, but it's primarily physical medicine to mobilize these secretions, and it works. Now I don't discount diabetes and how it affects so many people, but there were about half the number of deaths from diabetes as there were in COPD last year. But diabetes garnered almost $1.1 billion in research compared to $97 million for COPD. Why is that?
Man, that is something. That is. I was just looking at here, one of them, pneumonia and influenza, the flu, 164,000 mortality rate, 380 million in research.
3 times as much as COPD.
3 times as much. Yeah, I was just going to say that. Even Alzheimer's disease, 986 million in Alzheimer's disease.
Just short
and
of $1
dementia.
billion.
Yeah. And, we're not discounting anything about, research at all here, but we're just saying, COPD it's really like this just like almost forgotten killer, it's very silent killer here that we definitely need to raise more awareness on what we can do to keep people out of hospitals and maybe get some kind of research going in the future.
There are more younger people than the population would imagine that suffer from COPD. I think sometimes it has the stigma of being a terminal disease for elderly people. No, not necessarily the truth at all. Your listeners, might wonder, well, why is All County have an exclusive on this? Why aren't more agencies doing this? Well, they might be interested in knowing a little bit about how Medicare pays these home health agencies. They pay them on something that's called a HRG score, HHRG, and the acronym stands for Home Health Resource Groups. Now, sometimes this is also referred to as case mix, case mix score. And so what CMS has decided is, okay, if you get a patient and you're going to take care of them and they have COPD, then we figure this is worth $2,800 for a 60-day certification. Okay, so for 60 days, they're going to give them $2,800 to take care of that patient. Now, I don't know about other agencies, but All County Healthcare pays their nurses very, very well. And it probably ranges from $40 to $50 a visit. Okay, now you can see why some home health agencies might be motivated to hold back on the number of visits they make, because the fewer visits they make, the lower their cost of providing for that patient relative to the money that Medicare has paid them. The thing about All County Healthcare is now typically in these COPD patients with a protocol that's been established, in a 60-day certification period, that patient is going to be seen a minimum of 14 times. Many times it's twice that amount. So, you take 30 and multiply it by 40, and before any other expenses, that's what All County Healthcare is having deducted from what Medicare is paying them to take care of that patient. I actually have spoken to other home health agencies about, instituting a program like this. And, the response has been that there wasn't enough margin. Mm-hmm. Yeah. Because of the cost of providing. Now, we're not even talking about an initial acquisition. I didn't talk to a single home health agencies that thought it was a bad idea. But when we got around to the cost of acquisition of the ventilators to provide the therapy in the patient's home, then it didn't quite fit into their business model.
Sounds like it was about how much money was going maybe into their pocket versus the health care that they could provide.
Well, again, I can only speculate, Dave.
No, I'm just saying. No, I mean, definitely. How can, if people, say a hospital CEO sees this program or hears it driving around, or a CMO, how can they get in touch with you? They go through All County Healthcare?
All they need to do is call All County Healthcare and tell them that they would like some additional information.
Okay, and then you can come to them with a meeting presentation, talk a little bit about COPD and IPV treatments.
It would be my pleasure.
To keep readmissions out of their hospitals.
Yes, sir.
Awesome. Again, that's All County Healthcare, Medicare Certified Agency, 1-888-717-7170. Ask for Maddie or allcountyhealthcare.com. Thank you for joining us on the You and Your Doctor Show.
Thank you for letting us share with you a longer and healthier lifestyle. If you have a doctor or are a doctor and wish to be on the show, call AMP2 TV at 866-244-5422. and we will put you on the air as soon as possible. Tune in next week for more information on living longer and having a healthier life. The opinions expressed on the preceding sponsored program were strictly those of its hosts, guests, and callers, and not necessarily those of this station, its staff, management, or sponsors.